The study, published in the Allergy journal and accessible online, focuses on the immunophenotyping in Vernal Keratoconjunctivitis and the use of the Schirmer test for predicting therapy response. This work was born thanks to the collaboration between the Ophthalmology and Allergy department together with the research laboratory of innate lymphoid cells of Pediatric Hospital Bambino Gesù in Rome. The study's cohort includes pediatric patients affected by vernal keratoconjunctivitis, VKC. That is a disease of the anterior segment of the eye, primarily affecting children. Diagnosis is confirmed by the evidence of signs as an upper tarsal papillary reaction or limbal conjunctival nodules, and so classified as tarsal, limbal, or mixed when both signs are present. Using the Schirmer test, one of the tools already used in the ophthalmology procedures, immune cells were collected and analyzed by flow cytometry in order to help us to differentiate responder and non-responder patients. The table presents detailed demographic and clinical data of the study participants. We firstly isolated cells from Schirmer test paper and we characterized the immune cell composition, evaluating the presence of total leukocytes, T cells, B cells, and monocytes, focusing on the activation status of these cells. Graphs illustrate the statistical significance in absolute number, frequency, and activation status of total leukocytes in treated and untreated groups, as well as responders and non-responders. The flow cytometry results shown in this slide highlight the differences in immune cell populations between treated and untreated groups. In particular, T cells decreased in treated and responder patients. Moreover, these graphs provide a visual representation of the significant changes in cell types. In our cohort of pediatric VKC patients, we have defined different ranges to classify the pathological status and the response to therapy. In particular, this slide shows a comparison between clinical images and flow cytometry data over time for two representative patients, examined at T1 after the end of the treatment with the first cycle of cyclosporine eye drops and at T2, continuing or changing therapy. These two patients showed different responses to the cyclosporine treatment. Indeed, patient 1, who had at T1 high levels of leukocytes corresponding to the red area, displayed severe symptoms. At T2, the symptoms were resolved with tacrolimus-based eye drops treatment, with a consequent reduction of leukocytes infiltration. Meanwhile, patient 2 at T1 had a leukocyte count that fell within the green range, continuing treatment with cyclosporine and achieved the clinical resolution at T2 with a reduction in leukocyte numbers. Moreover, the evaluation of T cells can be a further marker to distinguish untreated and non-responders versus responder patients. In conclusion, the flow cytometry analysis of cells extracted by Schirmer test paper is helpful to improve the efficacy and prediction of therapy response, indicating that the changes in the CD45 positive cells can provide insights into the therapy's impact on immune cell population and clinical outcome.